Hi, everyone. We're just waiting to let a few more people come in, so we'll be starting in a couple minutes here. And thank you for attending. All right, we're going to go ahead and get started. So we'd like to welcome everybody and thank you for joining the Multicultural Veterinary Medical Association for this event. Thank you so much for coming. We just have a couple housekeeping things we want to go over here. If people would want to introduce themselves in the chat, you can share your job title, organization or school, and or city, state, country from which you're joining us. We're going to get started here. And I just wanted to kind of introduce the Multicultural Veterinary Medical Association, or MCVMA for short, for anybody who's not super familiar with us. The Multicultural Veterinary Medical Association exists to lead veterinary medicine towards the racial, ethnic diversity, equity, and inclusivity that our profession needs to serve a multicultural society. We envision an equitable and inclusive veterinary profession where people of underrepresented races and ethnicities are valued and supported in their careers, resulting in all communities receiving benefits of veterinary medicine. And you can learn more about our organization at our website, mcvma.org. I am Marie Sato-Quixall. I am the current treasurer for MCVMA, and I will be acting as our moderator here for our awesome panelists that we're so glad to have with us today. I just want to remind people that the session is being recorded and will be available for viewing later on our YouTube channel. Before we start, we just have a few housekeeping things. So we had over 300 people register for tonight's event. So there is a Q&A feature in the menu bar. And if you have any questions, we do ask that you put the questions in the Q&A section instead of in the chat, because it might get lost in the chat there. We can also track the questions, which ones we've answered, and other people can potentially upvote questions so we know which ones people are most interested in. You can also turn on live captions, and they can also do translations if English is not your primary language. You can go to the caption features on your Zoom menu bar, which should be at the bottom of your video here if you're on a computer or tablet, and you can click on show captions. There's a little caret in the top right corner of the button, and you can choose your preferred language. If you need any help, please use the chat to request help from our tech support. And it's kind of a brief introduction. We're going to be focusing on the recently released World Small Animal Veterinary Association guidelines on pet sterilization and the broader ongoing debate about spay and neuter practices. We'll explore the implications of these guidelines for access to care, equity in veterinary medicine, and how structural biases shape the way we define and approach reasonable or responsible pet ownership. The conversation aims to bring diverse perspectives to a complex issue impacting communities, veterinarians, and the animals we serve. We have three great panelists today that we're really excited to have. I'll let them introduce themselves quickly. Dr. Aziz, would you like to start?
Everyone, thanks for joining tonight. I'm Chumkee Aziz with UC Davis's Pet Shelter Medicine program. Thanks to MCVMA and my colleagues on the panel for being with me tonight, and everyone joining. Thanks.
Hi, I'm Dr. Jafarian. I'm a small animal veterinarian. I'm a board member for MCVMA and starting a PhD in the fall. I'm really excited to be here, really excited for the turnout, and happy that all of us are here tonight at the table to talk about these issues.
And I'm Dr. Julie Levy, Director of the Shelter Medicine Program at the University of Florida. And I have spent many decades organizing TNR programs and international spay-neuter programs and teaching our students how to do spay-neuter. So this is a very important topic to me.
Thank you so much, and thank you all for being here. Before we get into the discussion, we wanted to do a quick poll question for our audience. It's going to pop up in our chat here in a moment. Your answers will be anonymous. And so the question is, does your clinic, shelter, organization currently have policies that prevent adoption, fostering, or accessing veterinary services for community members or clients whose pets are not spayed or neutered? So we'll give people a minute here to kind of make their selections on that poll. It looks like we've got quite a few responses here. Let's see. Yeah, so it looks like a fair amount of people say that they do not have these and they like that their organization does not have these policies. Looks like almost half of the around half of the respondents said that. There were definitely some other in there. About 18% said they do and they agree with these policies. Around 8% say they do, but they'd like to remove these policies. And then 16% said unsure, and about 7% said no, but I wish my organization had more policies like this. So that's kind of definitely a spectrum along there where there's people in kind of all camps in this on this question here. And I think we were going to put some of those results in our chat here too. So you know, that's kind of brings up some of the important things that we wanted to talk about in our lecture here today. And so what we're going to start with is kind of the three documents that we're kind of discussing. There were links in the when you registered, there were links in there. They should be popping up in our chat here in a second as well. But we're going to have our panelists just kind of quickly go over the documents. So Dr. Aziz, if you could please share a quick summary of the WSAVA's guidelines for controlled reproduction in dog and cats, and highlight some of the key points that you believe relate to our discussion today.
Sure, thanks, Mari. If y'all got a chance to read through the 136-page document like everyone did, then you'll be able to follow through. But no, I will briefly share that the guidelines purpose was to help vets use current knowledge and literature to help pet owners make decisions around reproduction control for their dogs and cats. And this is particularly in light of literature in the past decade or so about the potential long-term effects of gonadectomy and that it might be more detrimental than we realize. And so the guidelines really are focused on that, and they specifically say that we're focused on helping vets make decisions that put animal welfare first. And if there are long-term health benefits or health detriments that we need to be concerned about, then we should not be making blanket recommendations around spay neuter to all of our pet owners, and we instead need to really tailor those recommendations based on breed or sex or lifestyle. And so in theory, this makes sense. The challenge is that y'all probably know this. A lot of the literature that has been coming out is the findings are inconsistent or they're conflicting. The studies are not as strong as we would want them to be. There are various challenges and biases in these studies. And so the guidelines have laid out recommendations based on these studies that have some inherent flaws in them. And so that's one of the primary concerns that's coming up. The recommendations are also, it's really important to remember, you know, WSAVA represents over 200,000 practitioners across the globe. But the recommendations they're making here, specifically that laparoscopic approach is the optimal approach, that prepubertal gonadectomy is inappropriate for most animals. These recommendations are not recognizing the reality of veterinary medicine, of pet ownership, of shelter medicine. And so that's another big challenge. And then we just want to lay out here too that the panel that wrote these guidelines, an amazing group of primarily board certified theriogenologists, but important to recognize that there were no general practitioners represented on the author task force, or shelter medicine or community medicine or spay neuter veterinarians. And so there's a concern that the guidelines fall short of representing the majority of pets and pet owners out there, and that a lot of what they're recommending might not be accessible to most pet owners. I do want to mention that since they were released, the organization did release an executive summary, and they also offered 2 corrections, one recognizing that there's a wide spectrum of approaches to responsible pet ownership, and another related to a conflict of interest. But we will talk about that more. We will also talk very importantly about this concept of responsible pet ownership as we move forward. Yeah.
Thank you, Dr. Aziz. There was a note, people may have seen it in the chat. Apparently the chat is not working, so we apologize for that. There's no way for us to fix it without restarting the whole webinar. So sorry, everybody. The Q&A seems to still be working. So if you have anything, tech issues or anything, or questions, please use that. It may be working now, but if it's not working, the Q&A feature does seem to be working. So thank you again, Dr. Aziz. So next we want to talk about after the guidelines were released, MCVMA did respond with critique of some of those points. Dr. Jafarian, can you please highlight what some of those critiques were?
Absolutely. And from the angle of the MCVMA, obviously our biggest concern was around this idea of responsible pet ownership and perpetuating these ideas within veterinary medicine and moving us in a direction that we should collectively be moving away from. So big concerns the MCVMA had with these guidelines was, first and foremost, the encouragement of utilizing implicit bias in determining who we deem as a responsible pet owner or not, and base our recommendations on that without providing a pet owner with the full spectrum of the current evidence we have and guiding them to a decision, rather making that decision for them based on our own internal biases. And we have copious amounts of evidence in veterinary medicine and even more in human medicine, because as always in veterinary medicine, we are always looking to the human med literature, but we know we can't make this determination, especially based on anywhere from a 10 to 30-minute appointment face-to-face time with a person, right? And we also know from the AVMA's data that the human-animal bond is strong across race, class, and ethnicity, and that we cannot determine based on someone's income how much money they will spend on a pet. Our other major point is that, again, we have this massive amount of literature, especially in human medicine, which is where we have the most information from, that there is a huge negative impact of implicit bias on medical providers on their patients. We go very deeply into it, and we'll go deeply into it later, but these have very serious negative outcomes for our patients. And also there was inequity in who was invited to the table that Dr. Aziz touched on, that we only had theriogenologists there, and we also had only people from the global north, right? So missing other cultural factors that play into spay and neuter, that play into our interactions with our pet owners, our resources in different areas of the world. And they completely ignored the significant financial impacts of not spaying and neutering your pet, and did not talk about preparing an owner for, if you do wait, these are potential consequences of waiting. In some circumstances, right, we can never predict what is going to happen. And so it is important to prepare any pet owner for those potential consequences, just like we do with anything else, right? We do a fracture repair, we talk about how it could go well or how it could not go well, right? So they're prepared on the front end of things. It was a very coincidental thing that I happened to cut a pyometra today, right? And that is like the perfect example that is still something we are very commonly seeing. It's a 10-year-old dog, 10-year-old large breed dog. We cannot predict what is going to happen down the line. And like we see in all these situations, it was a very thoughtful, very kind, very bonded pet owner who wanted the best for their animal. But those are the three major points we had a large level of concern on these guidelines.
Thank you, Dr. Jafarian. And then Dr. Levy, the Association of Shelter Veterinarians also responded to the guidelines with their own critique, which I understand that you reviewed. Can you highlight some of the main points from their responses?
Yes, and some of the responses are the same as the MCVMA pulled out. It is available as a publication in the Journal of Shelter Medicine and Community Animal Health. If you would like to find all of the details, it's quite a good look into this document. And I think what I reiterate again, what we need to keep in mind is the lens of the people who wrote the document. It is the lens of specialists and academics who generally restrict their cases to wealthy pet owners who can afford the funds and time to see specialists multiple times a year over the lifespan of their pet's life. Based on the literature they included in their document, which was hundreds of papers, very thorough in the section that they looked at, they have little experience or awareness of the vast amount of peer-reviewed literature supporting best practices in spay neuter, the techniques that we use to reduce risk and increase capacity to be more efficient and sustainable in our spay neuter practices, and pediatric sterilization practices. They were really quite nervous about small incisions and short surgeries, because in their hands, those did not go well. But we know in the high volume clinics that mortality and complications are actually lower than they are in private practices. So we've got good evidence-based literature now that we can refer to that these are very safe and efficient practices. And if you just think about it, when you go to get heart surgery, you want to go to the doctor that only does heart surgery, right? You don't want someone who kind of dabbles in everything. And so these high volume spay neuter clinics are very, very well functioning teams that do a good job in a way that keeps the cost down. But I could also say that it's quite clear that they have not spent time in shelters or with programs managing free roaming dogs and cats to understand the dynamics that truly do cry out for humane population management. It is just a missing void in this document. Instead, they systematically excluded experts from the mainstream veterinary practice and animal welfare organizations, and really did dismiss the role or downplay the role of spay neuter in the dramatic reduction of overpopulation and euthanasia that we've seen over the past few decades. By dismissing the very real problem of shelter crowding, disease, poor outcomes, stress on families and care teams, and an unwillingness to consider the connection between spay neuter and pet populations, they've also been unwilling to count the number of homeless animals and premature deaths that are associated with uncontrolled reproduction as a metric of the harm with lack of neutering, to factor in alongside the metrics they did use of associated with animals that are neutered. So when we look at the pros and cons of neutering, it's not just about that one animal that's in front and its risk. It's also about the societal risks that happen with not neutering or with neutering. And those really aren't counted. For instance, I think of, some of the cancers that are brought up in some of the research there, maybe 1% of cancer-prone dogs in a breed would get a certain kind of cancer, and that might be doubled to 2%. So you've got now 2 dogs per 100 maybe affected, but if that has to be balanced about the number of puppies that might die in the field or in the our shelters as a result of those animals not being neutered. So with their limited worldview, to summarize the whole big picture for what WSAVA guidelines advised, was no intervention for, it was recommended in most cases for female dogs at all. Most female dogs, they said you should do nothing, leave them intact. And then for male dogs, they said, as long as they belong to a responsible owner. Also in male dogs, maybe do vasectomies or nothing. And then castration as really the last ditch therapy that we would provide to our animals. So really leaving animals intact was the main recommendation for this. There's more nuance in the 135 pages, but that's the bottom line. They also called for allowing dogs, especially big dogs, as we know, to grow well past reproductive age before spay neuter if they are going to be neutered. And yet they're not transparent about the increased cost for care that they would be recommending. And just on that one neuter, it is so much cheaper to spay and neuter 10-pound puppy than an 80-pound adult dog. And that's not often made clear to people in the exam room when they're getting this information. And then we also know that if the females have about a 30% risk of getting pyometra over their lifespan if they're not spayed. And nowadays in an ER, it can run $5,000 to $10,000 for that emergency surgery. And then you might also read about the recommendations for gonad sparing surgery, which would be taking out the uterus in female dogs and leaving the ovaries. But it's not pointed out that in a study where owners did that, 30% of the owners came back and said, I don't like it. I want you to do the full spay. So now they've got 2 full surgeries that they've paid for and put their dog through. So with that, I would say those are some of my main concerns and ASV's main concerns with this document.
Thank you so much, Dr. Levy. That was a very good summary of what we're seeing there. And so what we want to kind of dig into and get some more detail on these points, we're also going to go through some of the questions that were submitted when some of our participants were registering. And then if people have more questions, please add them in that Q&A, and we'll have time after some of these questions to go through them. So Dr. Jafarian, you had mentioned implicit bias when speaking about responsible pet ownership. Can you help us understand what implicit bias is, how you see these guidelines encouraging implicit bias when discussing spaying and neutering with clients? Additionally, how might implicit bias have played a role in the authorship of the guidelines, and what can future organizations and individuals do to prevent this type of bias?
Thank you, Murray. So when we talk about biases, I think there's an immediate tightening up, right? This is a bad thing. I don't want to be told I have biases, but in actuality, evolutionarily, biases are an adaptive processes that allow us to use our prior knowledge, our experience to inform our decisions and our actions in the present. We could not function as we do as a society without biases. We use what we've learned from our environment to make these quick assumptions about who to trust, how to behave, what to say, those sort of things. And bias forms the lens in which we all see the world. So that means we need to understand that we all carry biases that are seeded and shaped and strengthened by the society we live in. I often use this example, and I don't mean this in a demeaning way, more that this is a term we are very familiar with, but human beings are socialized in the exact same way our animals are, right? What we are exposed to, what we experience, what we know to be true of the world, it shapes our entire reality. And our implicit biases refer to those attitudes, prejudice, and judgments that we unconsciously hold about people or groups. And by definition, we're either unaware of these feelings or we are unable to pinpoint exactly where they come from. And while everyone has implicit biases, because they're shaped by the society we live in, they aren't universal. So they're ingrained in our subconscious, again, through our individual experiences, upbringings, and backgrounds. So the important things to know about implicit biases is that it is unconscious, it is automatic, they are based on associations, again, within our past, within our socialization, within the families we grow up in, within the communities we grow up in. They can directly contradict our conscious beliefs. And that is a very important thing to note. And I will touch back on in a bit. And they are very, very pervasive. Everyone has them. Everyone is susceptible to them. And they're a very natural part of human cognition. So again, jumping back, plainly speaking, in these guidelines recommend and encourage veterinarians to determine whether a pet owner can be trusted to manage their behavior if they don't spay or neuter them. And this was doubled down by one of the authors in this, saying, we learn over time to judge our pet owner, and it is our responsibility to do so. And if we can't judge whether they will be responsible or not, just assume they won't be. And I would love to, I'm sure just with this community, there were people that were on the Access to Care call yesterday. And one of the speakers made this beautiful and very valid point in that we are often taught in our vet schools, sometimes in our clinics, that gold standard is it. You offer gold standard, or in some cases you offer euthanasia, for example, right? I cut a pyometra today. If you can't cut that dog that day where you're at, you recommend euthanasia, right? When in reality, if we're looking at this from a legal standpoint, if we do not offer that pet owner all of the potential options, this dog is not septic, this dog is still up and walking, this dog has good blood pressure, this dog has normal blood glucose, etc., that dog can probably wait in most situations to find a lower cost solution, right? But if we don't offer those options, we are not only setting this pet and this owner up for potential failure, potential very poor outcome, we are also setting ourselves up for litigation, right? For a board complaint, because we are not leading that pet owner through all of the potential options, right? And again, looking back at the negative impacts of implicit bias, that is what it does. We have all of this evidence that implicit bias, again, in human medical providers, but we can extrapolate from that implicit bias can cause providers to unintentionally make assumptions about their patients based on stereotypes and have lower expectations for patients to comply with medication regimens, or assuming a patient is exaggerating symptoms. This is a huge thing in human medicine, a huge issue, especially in things like pain management in human medicine. And they assume that symptoms are exaggerated based on race or their social economic status. And even when these physicians, their explicit beliefs did not correspond with their implicit bias, they still acted on that implicit bias when they were making decisions, because how many split-second decisions are we making every single day in the clinic? And if we're not stopping to think or stopping to offer all the potential options and just saying, this guy's responsible, this person isn't, then we're setting ourselves up for failure, and we're setting those pets up for failure. We also have this horrible body of influence that shows, and a large body of evidence that shows that people in racial and ethnic minority groups, again, in human medicine, were found to receive lower quality of healthcare than whites received, even when they were insured to the same degree, and when other healthcare access related factors such as ability to pay for services were the exact same. And that's exactly what we're setting ourselves up for here. And when we don't have diverse representation, when we're building broad worldwide recommendations like this, we have a panel that I don't think this was intentional. I don't think that they intentionally created this conflict around the idea of responsible pet ownership. I think they likely had blind spots like we all do. But when you have people at the table who all have the same background as far as their job, who all come from the global north, who all have very similar experiences, you don't know what you don't know. In education, they refer to the Dunning-Kruger effect a lot, and I think this applies very clearly here. And briefly, the Dunning-Kruger effect is the less a person knows, the more they think they know, and then the more a person knows, the less they think they know. And I think all of us in medicine can relate very deeply with those feelings. But that's what I believe what we're facing here is these authors had blind spots, again, that they weren't even aware of. Like Dr. Levy mentioned, I think they're not aware of the massive body of evidence we have in shelter medicine, in high quality, high volume spay and neuter, that these are evidence-based, these are very deeply researched, and we are practicing good medicine. It just doesn't look like what they are familiar with within their niche within veterinary medicine. And that's how I think we ended up here. And that's how I think they missed the mark on this aspect and missed the mark on talking about the economic impacts and the social impacts and the possible racial, socioeconomic impacts of these recommendations. No, I'll pass it off to the next question. I've been rambling a bit.
Yeah, thank you, Dr. Jafarian. Did Dr. Aziz or Dr. Levy, did you have anything to add to that?
No, I think in my life as pretty privileged veterinarian in a veterinary school, it's always helpful for me to be reminded about my implicit biases because we're all so busy and you forget that you have them and that they're natural and they're nothing to be ashamed of, but not noticing it and then not acting on those when you are aware, I think is where we get ourselves into trouble and start excluding people.
I'll really briefly mention Dr. Jafarian and Dr. Levy have already very clearly conveyed this, but the concept of responsible pet ownership is inherently biased, and it reflects, right? It's shaped by the values and expectations of white, middle, upper class communities, and that's a very narrow and limited perspective of what it means to care for a pet. It's not universal. It doesn't even mean it's necessarily the optimal way to take care of our pets, but it's often what we use to judge pet owners, like all pet owners. They have this documented in, again, like human medicine education, this concept of the hidden curriculum. We don't have it as well documented in vet school, but it's happening, right? I realize now it was happening to me. But there is, everywhere you go in our workplaces, in our education, there are things being taught to us, explained to us, imbued into us in between the lines, right? Implicitly. And those shape our perceptions of what it means to be a veterinarian, what it means to be a responsible pet owner, and asking our veterinarians to actually reinforce that by discriminating against pet owners is like the opposite way of where we want to go in our field, right? In our industry, we want to go the other way. And so it's not like, I agree, we need to recognize that this is a part of all of us, and then we need to actively combat it. So standing up for, if you work in a shelter, standing up for punitive adoption policies or fee-based policies that clearly are only here to inflict, pain on the human-animal bond for poor families, right? Like standing up for those things is a way to combat this concept of bias that we all have.
Thank you, Dr. Levy and Dr. Aziz. Those are great points to add to the conversation. Our next question we have is for Dr. Levy. What are some of the reasons individuals might give for not spaying or neutering their pets that you believe are often overlooked? How might our implicit bias towards spaying and neutering affect how we perceive pet owners of different identities, their relationship to their animals, and specifically their desire to keep their pet intact?
So I think now we're kind of flipping the conversation from the WSAVA document, which is generally negative about spay neuter and making it more of an exception or a fallback, at least for dogs. And I do want to clarify, like, if you take anything away from the medical part of this, is nobody is saying that we should reduce spay neuter of cats. Like, everybody's on board with that. And so, but I definitely know that there's a halo effect from all of this negativity about spaying and neutering dogs. It's people kind of generalize it to cats too, and at least we don't need to do that. There's really no significant evidence that there's a problem even with prepubertal neutering of cats. So when I think of different projects I've worked on around the world on spay neuter and talking to people who are either wanting to access it or not wanting to access it, or we're offering other services and we talk about it. Some different things have come up for me. And one is really just, what is our community's relationship with pets? There are cultural differences, and it's not like a community is homogeneous either. Within a community, there's going to be a lot of variation, but it can be. In my world, we think of dogs and cats as being owned and under our dominion. It is up to us to decide how they will live. We control what they eat, where they go, what their medical care is. And often, if you read Facebook posts from shelters and rescues, it's like, I expect to get unconditional love from this pet, which is pretty high bar to expect from anybody, especially someone who didn't have a say in the relationship. They just got picked, and now they have to have unconditional love. But not everybody thinks of pets as property or as an unwilling addition to a family. So there are cultures and people who think more about they are part of the community. They are part of my family. They may be sacred. They may be there just for working purposes. That's the relationship, or protection of the family. And then, so part of it is just our relationship with animals and how much we think we should control them to fit into our idea of what a perfect pet is, or a perfect working animal. And then there are many people who just are not familiar with spay and neuter. Families may never have had access to veterinary care. They may have had pets or not had pets, but they didn't go to a vet, or they only went to certain kinds of vets if there was a problem. And so some just might not have had the opportunity to learn about spay and neuter and the pros and cons of it. Or they may not know about the population level impacts and shelter impacts, where if they did know, they would make different choices. They may have grown up with unneutered animals, and that's just their life experience of how it is to have a pet. They may have had a bad experience with a veterinarian, or know of someone who has. And this could be a bad experience, like maybe a bad outcome or a very expensive outcome, or maybe just feeling disrespected by a veterinary practice. And so it was something they shy away from in the future. When we were doing a project in the Galapagos, we definitely felt, had it reported to us that some residents felt like it was just unnatural. Like, this is an alteration of the way the animal was made and the way it was meant to live. And it was a kind of an abuse of the animal to change that for them. There's sometimes religious objections. We also had that in the Galapagos, where there were many Catholic families that don't believe in contraception, and they extended that to their pets as part of the family, or just that it wasn't necessary. They didn't know the options, or they had lack of access to veterinary care altogether. And I would say that that is the most common experience I have. Is there's lots of people that would like to have access to spay, neuter, and other preventive vet care, but they just don't have it for all of the reasons that you know of about access to care. And I think that they may have heard also from this discussion over the past few years, we've had a lot of chatter about that sterilizing dogs is bad for them, and they would get cancer or they would get arthritis or other problems. And so that just the negativity over it. And trust also may be an issue. And I think back to, I saw someone from Pets for Life is here. And I also remember years ago hearing discussion from Bad Rap in Oakland, which is kind of a pit bull advocacy group. And they brought a lot of vet care to communities in Oakland that could use it. And they started out saying, we really strongly want people to spay and neuter these pit bulls because the shelters are overcrowded. And so they kind of use that as a lure and as a also kind of to manipulate people who wanted other things. They had to go through the spay neuter gate first to get the other things. And they just realized it was a total failure. They had these big events in the parks. It didn't work. And so they just removed that as the first discussion. And here's vaccines, here's food, here's different things. And so the folks I know who work with Pets for Life programs in different communities, they really lead with trust and getting to know folks and getting to have recruiting local neighborhood folks, residents who can pick up the campaign and spread the word, but they don't lead with spay neuter often. And that's something that people may come around to if they choose to. They don't have to, but it's not something that they hold out as a barrier to other care.
Thank you, Dr. Levy. Dr. Jafarian or Dr. Aziz, do you have anything that you want to add?
I have a very quick thought, and thinking about cultural differences as well as history. I often think about how much outreach there are in Indigenous communities, which obviously I think inherently is a great thing. But also there are two things that I often see. I often see quote unquote free roaming dogs and cats just being taken and adopted out elsewhere, when that is how a lot of Indigenous communities see ownership, right? The community owns them. That free roaming dog has maybe 1 or 2, 3, 4 different houses they're getting fed at, they get shelter at, etc. And also often we are doing trap, neuter, release on Indigenous communities, again, without specific consent from who may be the primary owner. And I don't think anyone has looked at this, at least not that I'm aware of, but I think about us as outsiders doing those two things with these Indigenous communities without community buy-in all the time, without knowledge all the time, without finding out who may own or be the primary caregiver of this pet at that time. And I think about the deep history that Indigenous communities also have with the people, the human beings in Indigenous communities being sterilized without consent. And I think about the people, the human beings on those communities who had their children taken from them and put in residential schools, because that is us as outsiders seeing that as a better life for those children, right? And what those potential impacts are. So again, this is probably me just extrapolating, but thinking more deeply that people have different histories than us, and considering that and including them in these decisions we're making. I guess I should say, instead of making decisions for them, having them be an active participant and having full say in what happens within their communities.
And I just want to follow up on that very important point, because a lot of us are volunteer vets. We go all over the world and do these projects, and we don't want to be parachuting in and doing our thing and then going away. These programs really should originate or be supported by the folks that live there, that should inform us what they need and want. And I do want to draw attention to a new document that's really incredible. It's called the Principles for Veterinary Community Engagement, and it was published last year in the same Shelter Medicine Journal, and it is a guidebook for how to have respectful community engagement. And it kind of boils down to the no program for us, without us concept that people need to be in from the very beginning and at every level of these organizations. So I'll put a link, I don't know if I can put a link in the chat to that really good document.
Thank you so much for all those very in-depth answers to the questions. It's so hard. There's so much good information. We want to go through all of this. So Dr. Aziz, I'm going to ask you kind of a two-part question. So one of the big things we're worried about is, with the guidelines was, responsible pet ownership, and kind of how we determine what is responsible pet ownership when it comes to things like reproductive care, population control, spaying, neutering. So if you could talk a little bit on how we can know if someone is a responsible pet owner and what that kind of entails. And the second part is kind of talking about what we had, the title of our session here today, gatekeeping care, and some of the things that we see, especially when it revolves around spay and neuter, those types of things. For example, shelters and rescues require all animals in a adopter's home to be spayed or neutered, and perhaps because they may equate that all pets being spayed or neutered equals being a responsible pet owner. So maybe some examples of other services that are routinely kept out of reach for families with intact pets or that are unwilling to spay or neuter their pets, and how mandatory spay neuter laws may play a role in gatekeeping care, and what are the impacts on communities and families.
To briefly answer the first part about responsible pet ownership, I know we've talked about it for a bit now. And I would say that how can we differentiate a responsible pet owner from a non-responsible pet owner is, one, we can't and we shouldn't, because that's not our job, nor is it our skill set. I mean, it's not our skill set, right? Sure, we have experience that we can share. We have dealt with many cases of PIOs or this or that. Yes, we can share that through a model of shared decision making, right? It's not oppressive. It's not paternalistic. It's not, we are deciding if you are a good or bad pet owner. But I can spend time talking with you and recognizing what parts, right? Like what factors, socioeconomic, cultural factors, what are these factors that affect not only your well-being as a human, but probably your pet's well-being as well? And what can I do to actually help you care for your animal in ways that I see you want to care? If you came into my clinic or my hospital, I think you do care. I know you care. So why wouldn't I respect that and serve that, right? I want to do that. I think that's part of it. And then the other part of the question was about gatekeeping. And, I think that and you might have mentioned this, there's on a small level, right? Like something as seemingly innocuous as requiring someone to have a driver's license or an address to adopt a pet or get services, or I don't know, apply for care credit even, right? Like, not that I think people should be applying for care credit, it's predatory, but every American has the right to get credit card debt. No, but seriously, like even something as small as that, that's biased, right? Not everyone has a driver's license. My mom doesn't have a driver's license, right? Like that is gatekeeping, because it actually doesn't speak to a person's ability to care for a pet. And it might seem like it intuitively, like, oh, if they don't have an address, what's going on? But as Dr. Levy has said, as Dr. Jafarian has said, and we know this because we experience this, pet ownership comes in every variety, and that is, we should be championing that, right? I think, I often think of it too as when we gatekeep, I think often we might be hurting the people who need our help the most, right? And we want to serve those people. We want to support them. We want to help them maintain their human-animal bond, because what things like mandatory spay-neuter have shown, at least in some of the counties I've seen it in is that without accessible and affordable access or the spay neuter, many animals will actually get relinquished to the shelter, which is the opposite of what we want. And so if we don't provide services or support the people who need our help the most, then we're actually doing a disservice to our Hippocratic oath, right? Like we're not helping ourselves or our animals.
Thank you, Dr. Aziz. And then we're going to hop into some of the questions that people are asking as well. Briefly, Dr. Jafarian or Dr. Levy, do you have anything you want to add to that before we hop into these questions?
I have a quick thought that, also the idea of responsible pet ownership is someone could, in the view of what is commonly cited colloquially as far as responsible pet owner, certain income amount, has a car, this, that, and the other, is also the leading cause of bankruptcy and homelessness in this country is healthcare bills. None of us are invincible. I could get in a horrific car accident tomorrow and turn into a quote unquote responsible pet owner because my livelihood is gone, right? I'm no longer able to work to the level I could. My father's a human physician family practice, and every single day he's seeing people lose their homes, lose their complete livelihoods over things completely out of their control. So also someone within a pet's lifespan can go from being, again, what we colloquially refer to as a responsible pet owner in a certain income bracket, able to provide certain things, right? A walk every day, for example, is acceptable for an able-bodied person. And that can change over a pet's lifespan too, right? Like all these things are very fluid and not anything real and concrete inherent within any human being. And I think it's important to remember that as well, that we are all vulnerable and we can all end up in a very vulnerable position and need that human animal bond even more.
Thank you, Dr. Jafarian. And now to get to some of the questions. I don't think we'll have time to get all of them. I apologize, but we'll get through some of these questions. The most upvoted question, I'll let Dr. Jafarian answer. Has WSAVA commented since MCVMA and ASV's critique?
They have actually, since both were released, ASV the most recently, Dr. Aziz referred earlier in this panel that they did add a correction to it, that they acknowledge that there is a lack of consensus and that especially around section 6, which is this section that is very heavy on this idea of responsible pet ownership, that they have seen that there is not consensus, that there is some conflict around that, and that they are working with outside experts and organizations. So they have reached out to MCVMA. My understanding is they have reached out to ASV as well, the Association of Shelter Veterinarians. So they are, it appears they're doing their due diligence to correct this, or at least look into it further, broaden their lenses. And as far as the working group, we have not met yet, but that is working on getting scheduled. And again, I do deeply appreciate that they recognize it, that they invited MCVMA, ASV, and other players to the table. So it does appear that they are trying to make things right, correct things, edit things in a way. What that will end up looking like, we're still not sure, but we're hoping that we can all come to a consensus that is beneficial for the veterinary community, animal welfare community, pets, and the people who love them.
And Dr. Jafarian, I just want to, I want to make this explicit. Like, it's not as if we believe or think that any organization, including WSAVA, knows everything about healthcare access and equity and the challenges of access. You know, that's not the point at all. But the point is still to hold all of us accountable, especially our professional organizations that represent us, to recognizing when they should be partnering up, when they should be seeking community engagement, when they should be looking for additional perspective, right? All of us are still accountable to that, and especially the organizations we're part of.
Thank you for that response. And I'm looking in our Q&As. There's another question that got an upvote here. What are ways we can promote assistance with veterinary bills while keeping the pet in the home? It feels wrong to me to fix up pets that owners cannot afford and then rehoming with a staff member. And anybody who feels like they have a good answer for that.
I think that's a big question. There's a lot of organizations that offer help in some way. One recommendation I would make for nonprofits or even for-profit clinics, so clinics and organizations that are seeking to increase access to care. One is American Animal Hospital Association came out with a really good guideline on what they're calling more like community care, which is to pull in all these organizations together with the help of social workers. I saw a question about that as well. These veterinary social workers are going to play a huge role in helping deliver care. And then to pull together what can we get from the for-profit sector without expecting them to lose money, more payment plans, where's the role of the nonprofit sector to come in and fill, and who's going to organize all that so it's easy to access the care that you need. And one thing for organizations I could recommend is Open Door Veterinary Collective. This is why they exist, is to figure out how to make, especially in the for-profit sector, veterinary medicine more accessible, especially with payment plans and other approaches. They've got great consultants. They will do consultations for your organization. And they also have a great website with training on like how to become a financially friendly clinic that you can take online certification classes. So that's where I would start and go from there. They also host a map where you can type in your zip code and say, I need pet food or I need, veterinary care or whatever, and you can find the organizations locally that provide that for you. And if you're not on that yet, go ahead and click on Pet Help Finder and add your organization.
Thank you, Dr. Levy. One of the other questions that people seem to show interest in, has anyone dealt with owners being resistant to spay neuter because they're breeding as a second income despite very much not following ethical breeding practices, and how do you approach this?
I will answer very briefly, so if others have more in-depth ideas. But yes, I have witnessed this. I've witnessed this at maybe a low-cost clinic where clients were in line and they were talking about meeting up and breeding their pets. And I remember thinking, like, oh gosh, what have we done? And this was like 20 years ago or 15 years ago, and I was like, oh no. And then I realized that that's okay. They are here. This is our chance to just at least have the initial conversation with them. I don't think any conversation should ever be considered the final and the most important or the best. Like, as physician or as doctors and as animal welfare staff members, I think we recognize that these conversations are nuanced, they're emotional, they need to be culturally sensitive. There's a lot that goes into this. And one one-dimensional conversation is not going to answer this very complicated question, or if someone is breeding for a second income. Everyone has the right to make a living and live life, and we are no one to judge that. But I do feel that if we can talk about it and encourage it, if people are interested in it, then that would be part of our responsibility.
I think that's a great point, right? And it's about building that relationship of trust and non-judgment, because we all have that knee-jerk reaction, right? We all do, because we have seen the worst of the worst, and it creates bias within us, right? I often think, I'm first-gen immigrant. My family was very, very poor. And my father worked with low-income communities and has worked his whole career. And there is a very short comment he would make anytime I would judge someone like doing a crime or doing something like this that I would look down upon, right? And he would say, "You don't understand because you've never been hungry." And that's something I think about all the time, right? Like, your mother wasn't a drug addict, you were raised by both parents, your father has a college education. You don't understand because you don't understand, right? That Dunning-Kruger effect. I have no idea what that person is going through. I just have this tiny snapshot of their life, right? And I think that's a very important thing to remember, that people are both very, very different and very similar. And you don't know how you would act if you were in a similar dire situation, right?
Thank you for those responses. So we're kind of at times, we're going to try and wrap up briefly here. We appreciate everybody coming, all the panelists and all the attendees. Kind of our closing question is, what can individuals and organizations do to address gatekeeping care and issues like racism and classism in veterinary medicine or animal welfare spaces? We'll try and keep it brief because I know we could probably go off on a whole nother hour lecture on that, but we'll try and keep it brief to respect everybody's time.
I'll just briefly mention that we each have the responsibility to deconstruct and dismantle racist and biased and oppressive systems that harm pets and pet owners in our communities. We each have that individual responsibility, so however small that looks on a daily basis. If we see something unfair, unjust, biased, step up, speak out. Even if it makes you feel awkward, just say something. You will have helped probably. And then also what I mentioned earlier is we have to hold our bigger organizations accountable to the same thing. AVMA, WSAVA, and our veterinary education system. That's a big one too, right? This needs to change from the ground up, and that's what we need to be working towards.
And I'll just add to that, that we need to look at our own organizations as well and find out, like, what's on the website. Are we gatekeeping? What are our volunteers feeling? Are we helping them understand to be more open-hearted and to help people and their pet families with what they need without judgment, and change those things? And then we see it all the time in our social media groups. I think, a lot of judgment, and there's a lot of reinforcement of that judgment about, perfect pet owner and who you should adopt to, and the animal can stay in your care forever until this perfect unicorn person comes along that fits the criteria that people are making up. And so call it out and ask for the evidence, ask people to be fair, show them the way of how we can be successful by being more open and fair.
I think those are all great points. I don't have a lot to add to that, except follow MCVMA. Just kidding. But it is, right, listening to minority voices in your community and outside of your community, right, within vet med and outside of vet med, and also utilizing the resources we do have. Dr. Levy referred to a wonderful resource. I should preface this by saying we are going to send out an email with all of these linked as well. And of course, because I'm on the spot, I'm forgetting the name of the paper, but there's this wonderful paper in social work that talks about both individual and organizational questions we should all be asking to avoid falling into these biases, these mistakes, that I also think is a really wonderful resource. And we'll include that in our email that we send out as well.
Thank you so much, everyone. Dr. Jafarian, Dr. Aziz, Dr. Levy, we really appreciate you coming and going over all this really good information, having this really good dialogue. We appreciate all of the participants, the audience that came and asked some really good questions. I'm sorry we couldn't get to everybody's questions. We are going to be putting a feedback survey in the chat. So if people could just give us some feedback so we know what you liked about the conversation, what we could potentially do better, other conversations you may want us to have in the future. And then if you're looking for more ways to connect with the veterinary community and MCVMA, we are doing community connection events via Zoom, where we have small group conversations. The next one that we're having is going to be in June. Let me pull up the so it's going to be June 24th, 5 p.m. Pacific time. And we're going to be talking about the tax on diversity, equity, inclusion in academic spaces and what it can do to keep the spirit and promise of DI alive. You can also find information. We're going to put that, if people are interested in that, in the chat as well. You can also find links on our social media. Yeah, and I just want to, again, just thank our panelists and everybody for coming to this panel today. We really appreciate everybody. Thank you on behalf of MCVMA.
Thank you all.